Well, we're so glad to have you with us here at the Q102 Cares for Kids Radiothon. This year, we're able to do something a little bit different. Everybody's used to Zoom. And what we're doing is we're talking to people from the hospital. We've also been catching up with families. One of the folks I guess we've been most excited to talk to is Dr. Roberta DeBiasi. And she's with us. And did I say that right, or did I really hatchet up your name?
That was pretty good.
Okay. I'll take pretty good all day. So Dr. DeBiasi, what we understand is, without going into great lengths on your resume, but what you are at Children's National is sort of their go-to person when it comes to information about COVID. And so welcome to the Radiothon. We're really happy to have you here. Parents really want answers about COVID and kids.
Yes.
And I know that kids have been impacted by COVID, but we've heard so many different things over this past year and however many months. Can you talk to us about kids and COVID as you see it there at Children's?
Sure. You know, when this all started just about a year ago, we all thought that kids may not be infected. And in fact, when we first heard about this disease coming out of China, it seemed like there weren't many kids involved at all. But as soon as it got circulating in Europe and then got to us in the United States, it was very clear that that was not the case, that kids definitely are infected. All ages of kids are infected. And a small percentage, about 3% of the kids who are infected, get sick enough they have to come into the hospital. And that's what we've spent a lot of time doing here in the last year, is taking care of those children that both either don't need to be in the hospital or do need to come into the hospital for care.
So wasn't Children's one of the first to set up pediatric testing?
Yes. So we had a drive up or walk up ambulatory testing site that was dedicated only to children. It was the first in the country, actually. There was one other group, I believe, in Denver doing that. But really all the other centers were primarily aimed for adults. So this was something very unique. And we tested thousands and thousands of children at that site.
And gang, while we're talking, just remember, this is your local children's hospital doing this right out front. And that's why we support them. And you can become a Chris and Rosie Miracle Maker right now at 667-2102 and help to continue supporting excellent care like this. So you've been conducting research on treatments, is that right?
Yes. So we have had now over 2,000 children who have had some symptoms significant enough that they come to Children's Hospital for us to take care of them. And about 400 of them have had to stay in the hospital, that they were sick enough that they had to come into the hospital. And then when they come into the hospital, we have treatments that we use. And there's a whole host of different things that we've learned work very well to treat children with COVID infection, whether that is their first infection or if they're coming in a month or so later with that inflammatory disorder that you may have heard about on the news called MIS-C.
Can you tell us a little bit? I don't want to scare our listeners, but this is something that's very concerning, that kids get this secondary sort of, is it an infection? Is that what it is?
Well, there's two things that bring kids into the hospital. One is the regular COVID that you hear about in adults, where they get their first infection and it primarily affects their lungs and their ability to breathe. And they might have to come into the regular hospital, or they might have to come into what we call the intensive care unit, where we can help them go on a machine if needed for their breathing or for their blood pressure. So that's one kind of reason you'd have to come in. This other thing we're talking about called MIS-C, M-I-S-C, really is what we call post-infectious, meaning a month later after you've had your infection, the body just makes too much chemicals that make you agitated and have inflammation. And it makes their blood pressure very low. It makes their heart not pump very well. And they can have problems unless they go on life support, essentially. So that's what we've been doing at Children's Hospital.
Holy smoke. So I know we were talking to a lot of parents, and they seem very, very focused on, interested in a vaccine for children. They want to know that their kids, I mean, isn't that what you said?
Absolutely, yes. I would want to know when my kid could get a vaccine. Yes.
Sure. That's a great question. You know, vaccines are the way we're going to get out of this mess. We're
Right.
already seeing a great progress in vaccination across the world. Some countries have half of their population vaccinated, and we're getting there in the United States. I think we're up to about 14 or 15%. We had a new vaccine just approved this weekend, so that one's going to be great with just one shot and needs much less refrigeration. But if we, as of today, we can vaccinate children down to 16 years of age with
Mhm.
one of the vaccines that's currently available. And all of the vaccine companies that we have are already studying down to 12 years of age. So we expect that information hopefully in the next month or so. So we really expect this to be opening up to kids down to age 12. I'm hoping by, early spring. And then
Awesome.
immediately it's going to move down to the lower age groups. And children's is hopefully going to be part of those vaccination trials down to these younger age groups.
Wow.
Well, that is encouraging. It really, really is. Have you got advice for parents who have kids who may not want to wear a mask or?
Yeah, it's a great question. So this is a message that I think parents have to deal with this all the time. How much do
Mhm.
you worry? And then how much do you just say, well, I'm not going to worry about that?
Yeah.
And COVID is an exact example of that. So if you ask me, my particular child, how likely is it they're going to end up in the hospital in the intensive care unit? It's actually pretty low. 97% of kids who get this infection are going to be fine. They're going to have a cold. They're going to be, not feeling well or whatever. However, I can't tell you that your child is not one of the 3% that's going to end up hospitalized or even in our intensive care unit. So there's no way for us right now to say that your child is not at risk. And I wish I could tell you that we don't have normal children, that get really sick. And in fact, for this Miss C, almost all of these are completely normal children. So there's no way you would have known that they were at higher risk for this disease. So taking all that into consideration, what we try to tell parents is don't panic. Don't do anything with your life. You need to move on with your life, but you need to take every precaution you can, just like you wouldn't let your child ride in a car without a seatbelt, right? It's unlikely they're going to get in an accident and end up in the hospital if they're not, it's unlikely they're going to get in an accident while you're driving. But if you are in an accident, you sure as heck want to have that seatbelt on. And that's exactly what the mask is doing. It's doing what we can and also preventing the transmission to other people, because we certainly don't want to be responsible for having someone else's child or loved one get sick and end up in the hospital.
It's a really good answer.
Yeah.
I'm so thrilled that we have Children's National. I always say it's waiting at the end of 66 with open arms. Anytime your child is in need, they'll take your child and say, let me heal your child. Let me do my very best. And now that COVID is here, and it is a threat for kids, you're on top of that too. And it doesn't surprise me. It just
No.
makes me feel
Yes.
so much better that I support you guys and that we all support you. That's what we're here to do as a community. And you can do that by calling 667-2102 right now and becoming a Chris and Rosie Miracle Maker. Take 2 minutes of your time. 667-2102. Here comes a pandemic. Bam, they're on it. Just like that, they were on it. So I don't want to take any more of your time. I know that you're very busy. You guys work so hard and we really do appreciate it. But is there anything else that we haven't talked about that you just wanted to share with our listeners?
I think you should just know at Children's Hospital, it's not just doctors. We have scientists, we have doctors in critical care medicine and any specialty you can imagine. We're all working together every single day. As a matter of fact, right before I got on this call, I was on a meeting with all of our folks that take care of the multi-system inflammatory disease kids. And we all every week put our heads together and look at all the new information and try to optimize the care of kids. So you should know that it's not just a hospital, it's a whole group of people coming at problems, not just this one, but anything you can think of from many different specialties and expertise. And we really appreciate the support of the community to help our research and to make things better for children and families really across the country. So thank you very much.
Thank you
Yes.
so very much. And thank you for supporting them. Again, 667-2102. Become a miracle maker. And that's exactly what you're doing. You're helping miracles happen just like this. You guys are incredible. I wish I could, there's no way to tell you how much we think of you and how
It's
grateful
true.
we are. What you do is just miraculous. And thank you so very much. Take care. And thanks for being part of the Chris and Rosie show and being part of our Radiothon today.
Thanks so much.
Thank you.
Thank you.